There are 206 bones in your body, 642 muscles, and more than 4,000 ligaments and tendons. That's a lot of parts that can wear out. And at Scranton Orthopedics, we have a specialist on staff that can fix every one of them. To schedule an appointment with any one of our orthopedic surgeons, simply give us a call or request your appointment online. Scranton Orthopedic Specialists, healing injuries, changing lives. Hi, I'm Jane Adonisio. When you need a doctor, isn't it nice to know who they are before that first appointment? I've had a chance to meet some of the doctors here at Scranton Orthopedic Specialists, and now you can get to meet them too. Rheumatologic conditions affect nearly 50 million Americans and cause more disability than heart disease, cancer, or diabetes.
I am Eugene Grady, a rheumatologist at Scranton Orthopedic Specialists. As a rheumatologist, our background is in internal medicine. We see a wide variety of musculoskeletal conditions. When I initially see a patient, I'll do a thorough history, review systems, physical examination, and even do x-rays, which we can do here on site. After putting that all together, you try to figure out whether that person may truly have an inflammatory process or whether they fit into a non-inflammatory condition. And again, that evaluation leads you to that diagnosis. It's been a very exciting time in the past 10 to 15 years. There have been many advances in mostly our autoimmune processes. There are now several medications that target a specific part of the immune system that can very effectively control that immune process and put it into a state of remission. Many of those therapies we do here at Scranton Orthopedics. We have an infusion center which we provide infusion therapy for conditions such as rheumatoid arthritis, lupus, psoriatic arthritis, and we also provide infusion therapy for osteoporosis and Paget's disease. For patients having physical therapy, occupational therapy, and an orthotic department here on site is extremely helpful. When I send a patient for therapy and they go to an outside facility, I get a letter back how they're doing, but I don't get that one-on-one contact with the therapist. So if along the course of their therapy, the therapist feels that some changes may be made, then that's handled one-on-one with that therapist and can really help expedite the patient's success. As a rheumatologist, it's difficult but fun trying to figure out a person's problems who may have seen 1, 2, or 3 other physicians and they have a wide range of complaints, and it's kind of like putting a puzzle together to figure out their problem.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. More than 43 million Americans suffer from joint pain caused by arthritis.
My name is Chad Gidgerelli, General Orthopedic Surgeon at Scranton Orthopedic Specialists. As a general orthopedist, I see multiple things. My main specialty is knees, shoulders, and hips, but I will see people with back pain, carpal tunnel, ankle problems, so I will see a variety of problems. I think the most important thing as a physician for our patients is to make the correct diagnosis, to listen to people. For the most part, they're going to tell you what's wrong with them. I get a lot of feedback from patients that come from other doctors, and it's, well, they didn't talk to me. They didn't touch me. They just put the x-ray up on the screen, they looked at it, came up with a plan and left the room. So I think the most important thing is to talk to patients and to make the correct diagnosis. And once you have a good history and physical exam, most problems are already diagnosed. And then once we put all that information together, then we could come up with a treatment plan. I think I take probably more of a conservative approach and try to treat people without surgery. A lot of these problems that we see with people can be treated conservatively and be managed without surgery. We're really a multi-specialty group. We really are able to help each other out. Each of us have a little bit more of a specialty than others, so we can bounce information back and forth. The therapy and the orthotic company, is a great adjunct to what we do. We could send our patients to the therapist. They know exactly what we want, and we can communicate back and forth to see how our patients are doing. The same thing with the bracing, that they know exactly what we want, and they offer the highest quality of bracing that you could get. So the combination of everything really gives, I think, the patient a great experience when they come to Scranton Orthopedics. I think the best cases are the ones where the people are pretty much debilitated, that affects someone to the point that they really can't do anything in their activity. To be able to do a hip replacement on someone and then within 2 days, they're up and it's almost like they have a new lease on life.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. Right now, 31 million Americans are suffering from low back pain.
My name is Dr. Gillick. I'm an orthopedic surgeon with Scranton Orthopedic Specialists. The most common back and spine conditions have to do with discs and nerves. We commonly see herniations of discs that will cause pressure on nerves and give individuals pain that will radiate to their arms or to their legs. And then we try to formulate a treatment plan to try to resolve that type of an issue. Could be anything from non-surgical treatments such as physical therapy, medications, braces, all the way up to and including surgery, and there are various types of surgery that we need to address different types of spine problems. One of the myths I hear all the time is, I'm too old for spine surgery, I'm too old for surgery. A lot of that comes because for many years there were only 1 or 2 or 3 surgeries that were done for all spinal conditions, and I think the key to having successful outcome of spine surgery is that you can identify the problem and then do the appropriate surgery for that problem. Spine surgery, particularly for what's called spinal stenosis, which is the pinching of the nerves or compression of nerves in the lower back that comes from arthritis that develops over time, is fairly easily relieved by surgery. And when I say easily, I mean a surgery that has low risk and a low complication rate and a high success rate. We commonly do that on patients in their 80s and even on occasion into the early 90s. Over 25 years of spine experience, I think, helps with more confidence identify the condition causing their pain or their disability, try to recommend the appropriate diagnostic studies, and then to formulate a treatment plan that's going to be beneficial to that patient, be it surgical or non-surgical.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. Right now, 31 million Americans are suffering from low back pain.
I'm Chris Henderson, and I'm an orthopedic spine surgeon here at Scranton Orthopedic Specialists. In my practice here at Scranton Orthopedics, I see mostly adults, but I also see a lot of kids. Mostly we see are with scoliosis. More often than not, we're seeing adults, and most of them are coming in with neck pain, back pain, leg symptoms or arm symptoms from pinched nerves, herniated discs, stenosis, degenerative disc disease. Most of the treatment options we offer right here. We have physical therapy right here in the building. It's a great option for the patients because the physical therapists are right here. So if the patient's not progressing like they would hope, or there's a question about their care, they can shoot me an email or even come right upstairs and talk to me. With the brace techs downstairs and the clinicians that really do a great job with back braces, they're right there downstairs, so if a patient's having a problem with a brace, I can get them right downstairs and it can be adjusted or fixed or whatever needs to be done. The bulk of the patients that we see actually don't need surgery. Most adults at one point in their life or another have neck pain or back pain, and for the most part it's short-lived and can be treated with conservative treatment. We reserve surgery for the minority that don't improve with the conservative treatment. Nowadays, in spine surgery, the lines between a neurosurgeon and an orthopedic spine surgeon have blurred. Most neurosurgeons and fellowship-trained orthopedic spine surgeons can manage any spine problem from the cervical spine down to the lumbar spine. A lot of my day as a spine surgeon, I spend fighting some of the old notions about back surgery, some of the stigmas that come with it. The technology that we have nowadays is really advanced. in the last several decades. For the right problem, surgery has great outcomes comparable to hip replacement, knee replacement surgery. And the whole goal, obviously, is to get the patient's pain better and get their quality of life better, get them back to doing what they want to do.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. "90% of knee replacement patients experience complete relief from pain and an improved quality of life."
I'm Jack Henzis. I'm an orthopedic surgeon at Scranton Orthopedic Specialist. I'm a general orthopedist with an interest in knee injuries. Orthopedics covers a wide variety of patient ages. We see younger children with mostly fractures, but they can also have sports-related injuries. We see adults with more sports injuries and overuse type injuries, as well as arthritic type conditions that cause them a lot of pain. Adults are more active in sports activities later in life. We have more young people playing sports activities on a daily basis, especially children and adolescents play multiple sports at a time, and so there are probably far more injuries today than we may have seen 15, 20 years ago. Generally, surgery is not the answer. Conservative care is the initial treatment. We can strengthen their legs and knees to make them more flexible, have better strength, better endurance, and less difficulties with routine activities such as walking or performing household chores. When that doesn't work, then surgery would be beneficial. The older patient generally does extremely well when they have surgery because now they've eliminated their pain that was causing them a lot of issues. It improves their function, so now they can perform their activities that they want to do that they couldn't do before, such as household chores, maybe outdoor work, as well as following their grandchildren to sporting activities or shopping or vacations. Their life is returned to them. They have a much better quality of life than they had before. It's the ultimate compliment when the patient comes back to you and thanks you for everything you've done for them to restore their quality of life.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. There are approximately 3.5 million sports injuries every year in children under the age of 14.
My name is Paul Christopher Metzger. I'm an orthopedic surgeon specializing in sports medicine and arthroscopic surgery. We'll see the whole gamut of a lot of knee injuries, a lot of shoulder injuries. We do see fractures, a lot of hip, elbow, ankle injuries. I would define sports medicine as a subspecialty in medicine. We deal with people that exercise, we deal with athletes, and it involves diagnosing problems, treating problems, and eventually hoping to prevent problems. Sports medicine leads the way. Back in 1989, when I got a phone call from the Philadelphia Phillies organization asking me if I would be willing to take care of the Philadelphia Phillies AAA club. It's been a great experience for me and has certainly helped me be on cutting edge as far as sports injuries are concerned. So I've been able to deal with professional athletes and then also deal with a lot of high school and junior athletes too. Just because you don't play a professional sport doesn't mean that playing weekend softball isn't important to people, or running, participating in martial arts, whatever recreational athletes we have. It's very common for me to hear people say exercise or my participation in the sport is of utmost importance to me.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. Each hand contains 27 bones and 3 major nerves.
I am John Rich. I am a hand surgeon with Scranton Orthopedic Specialist. Hand surgeons see a variety of problems. We see everything from congenital abnormalities to arthritis to traumatic events that involve bones, ligaments, nerves, blood vessels. The most common thing we see is carpal tunnel, which is well known, but deal with multiple problems from a variety of different mechanisms of injury or development. Most patients I see with hand problems are actually treated non-operatively. Many things can be done to help patients that might include therapy, medications, injections, bracing, that allow treatment without surgery. The advantage of on-site services allow a closer relationship between the therapist and myself. It allows for a quicker correction of problems that they may develop and a quicker treatment of problems that they might develop. So as opposed to the patients being seen by a therapist someplace else, there's an issue, I actually have to physically see the patient before they can go forward. The patient has to drive here for me to look at them for maybe just 2 seconds to have them go back to the therapist. I can really just run down the steps and see them. I think the approach here at Scranton Orthopedic Specialists, and certainly the hand department, is to provide a comprehensive approach, make the diagnosis, inform the patient of their diagnosis, what their options of treatment really are, then look at each option as it pertains to that particular patient. And again, 2 patients with the same diagnosis may take completely different courses to treat their problem based on not just the diagnosis, but who the patient is, what function they need for their hand or their hand injury.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. By 2018, experts estimate there could be as many as 3.2 million annual knee replacement surgeries.
I'm Dr. Harry Schmaltz. I'm a hip and knee joint replacement specialist with Scranton Orthopedics. My practice concentrates on joint replacement surgeries of the hip and the knee for lots of diseases, but mostly arthritis. The single thing that stands out is always pain that interferes with your ability to live life the way you want. So it's pain in your hip or your knee that's really keeping you from doing what you want to do. There's a lot of genetics involved with osteoarthritis, so that's prevalent, that's been there. Activity levels tend to beat up joints to some degree, and probably the predominant thing that's talked about in all phases of our society is obesity. Knee replacement and hip replacement are such different experiences now than they were even 5 years ago. I think there is an increasing understanding for many of us that many knees only need a partial knee replacement, where only part of the knee is significantly diseased and the rest of the knee is in its natural state and doesn't need to be replaced. So it's a smaller operation that's easier to recover from, and sometimes with a better outcome. Hip implants have gotten smaller, and the big issue for hip replacements, as well as knees really, is how long do they last? That's a common question we get in the office. And the good news about hips is that they are lasting longer. The current generation of implants, which really came into widespread use 10 to 12 years ago, we're now seeing in patients, and they have almost negligible wear. So these are hips nowadays that have been in service for 10 years and showing very little to no wear. So the future for these things is terrific. We understand a lot more about pain now and how to control it and how to block it, and there are better techniques and better drugs available that make getting through an operation like this a lot less painful and traumatic for the patient than it used to be. I've had lots of patients say, "Thank you for giving me my life back." If you can't play golf, ride a bike, play with your grandkids, or whatever it is for that individual, we can get them that ability back. That's a marvelous revelation for some people to be able to get that back.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. Your feet have 1/4 of all the bones in your body, 52 bones in all.
I'm Dr. Timothy Seebecker, and I'm a podiatrist here at Scranton Orthopedic Specialists. We see all disorders of the foot and ankle. Sports injuries, overuse injuries. We do see a large number of forefoot deformities, to include bunions and hammer toes. We see newborns with club feet up to elderly patients with a variety of foot and ankle complaints. Really anything that involves foot or ankle problems or complaints we would see. The vast majority of people are treated non-surgically. There's a variety of different ways to treat it. Physical therapy is one of the things that we oftentimes prescribe. A variety of braces, shoe alterations. We try and start with the simple things before you're moving into the surgical area. We have Keystone Orthotics and Prosthetics in the basement of the building, and they provide a very valuable service to us in the way of braces and orthotics when those are appropriate treatment recommendations. It gives us the ability to interact with them. They get to know us, we get to know them. kind of know what their treatment style is. They start to understand what our treatment style is. Most outcomes are very good. The difficulty I think that we encounter is the length of time required for healing after an injury or a surgery. I think many people don't expect the length of convalescence required, but most people in the long run have a very good outcome. It is rewarding to see patients who are injured go through a treatment protocol and then return back to their pre-injury level of activity.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. Shoulders are the most commonly injured joints in the body.
I'm Michael Tracy, native of Scranton, Pennsylvania, attending shoulder and elbow surgeon here at Scranton Orthopedic Specialists. In the patients that I see a wide variety of conditions. I take care of everything from the high school athlete that has throwing issues, pain in the elbow when pitching, to the middle-aged patient with a rotator cuff tear, all the way up to the 60 or 70-year-old patient that has arthritis in the shoulder, joint replacement conditions. And then I also do a lot of traumatic work, so I take care of fractures that involve the shoulder and the elbow. Fellowship training means that a surgeon has spent additional time over the basic orthopedic training concentrating on one specific area. So after I finished my general orthopedic training, I did another year where I focused entirely on shoulder and elbow problems. What that means is that I bring an area of expertise and a level of familiarity with these issues that's difficult to find outside of academic medical centers. And most of the shoulder replacements in this country are actually done by surgeons who do only a handful a year. Any surgeon who does more than 5 of these operations in a year is considered high volume. In my practice, it's not unusual that we'll do 4 or 5 of these operations a month, if not even a week sometimes. That extra volume translates into better care for patients because we know that surgeons who do more of these operations have fewer complications and better outcomes over time. Shoulder pain is actually a very complex field, and there are a lot of different things in the shoulder that can go wrong. One of the common misconceptions I see in the patients that come to see me, they're often afraid to actually come and be evaluated because they're worried I'm going to tell them they need to have a surgery on their shoulder. There are a lot of problems we can take care of with non-operative measures to get people back to enjoying life and get people pain-free. Not all shoulder pain needs to be operated on, and certainly that shouldn't be something that prevents patients from coming in and being evaluated and finding out what the options are. My specialty is devoted basically to quality of life. I help patients get back to the things that they want to do without pain. Oftentimes we can get pitchers back out on the mound, we can get laborers back to work, and we can get our senior citizens back enjoying life and doing activities and enjoying their retirement without pain in the shoulder or the elbow.
For more information about our services or to schedule a personal evaluation with any of our orthopedic specialists, we invite you to call our office at 570-307-1767, or you can request an appointment online at scrantonortho.com. Is it broken or just a sprain? We've all asked ourselves that question, but dread the long wait at the emergency department to learn the answer. Don't suffer and worry. The Injury Treatment Center at Scranton Orthopedic Specialists is the fastest and easiest way to get peace of mind and the best treatment for your injury. We're conveniently located inside Scranton Orthopedic Specialists and are open Monday through Friday, 8 a.m. till 7 p.m. Our team of orthopedic surgeons and specialists are ready to provide you with same-day, no appointment, walk-in treatment for all bone, joint, and muscle injuries. Scranton Orthopedic Specialists. Healing injuries, changing lives. Each year, nearly 50% of Americans develop a musculoskeletal injury that lasts longer than 3 months.
I'm Mark Lombardi. I'm the Director of Rehabilitation for Scranton Orthopedics. My job is to oversee the care and treatment plans that are developed and delivered to the patients. We come with a variety of experiences, both in long-term care as well as acute care, and then we bring that experience to the table for the patient in an outpatient setting. We have both physical therapy and occupational therapy. The occupational therapy is delivered through two professionals. We have a certified hand therapist, and then she's supported by an occupational therapy assistant. And on the physical therapy side, myself and 4 other professionals, all with advanced degrees, deliver the physical therapy to the patients. We chose particular pieces of equipment that we felt were going to best address the needs of the patient. We get a variety of orthopedic patients from, say, 5-6 years of age to 80-90 years of age. So that in of itself requires a pretty diverse pieces of equipment, but the expertise and the training that the staff brings with them affords them an opportunity to use these at a high level for the patient's advantage. The biggest advantage for patients that choose to come here is the coordination of care. We have a direct line of communication, which really affords the patient a high level of care, because in talking to the physician, we're able to develop and progress a care plan that is really in the patient's best interest. We find that it leads to a higher level of care and shorter stays. The most rewarding thing is really in the restoration of function. We're fortunate that we get to provide some of the care to the professional athletes in town, and so certainly, at a high level, watching them go back to their trade is certainly rewarding. But seeing someone's grandmother who came in perhaps in a wheelchair leave walking is probably equally or even more rewarding because of the relationships that we have with our grandparents or parents. And so to see that come back is truly a rewarding experience, and one that, again, we give the credit to the patient for putting forth the effort that it takes to get there.
For more information about our services or to schedule your physical or occupational therapy appointment, we invite you to call our office at 570-307-1769. One out of every 200 people in the United States have had an amputation.
My name is Dave Patrick, and I am a physical therapist and a certified prosthetist orthotist, and I'm director of orthotics here at Keystone Prosthetics and Orthotics. We specialize in providing artificial limbs and braces to people who have had amputations and have lost limbs, and bracing is provided for a number of different reasons. It may be someone who's had a stroke, it could be someone who's had an athletic injury that needs a device of some sort to be able to participate in athletics again, someone with scoliosis and needs a corrective type of device. We'll do lower extremity orthotics, upper extremity orthotics, and spinal orthotics. We're fortunate to be here with Scranton Orthopedic Specialists right in the same building. It gives us tremendous communication with them, and oftentimes what they will do is they will refer patients down for bracing type of devices. We can try more conservative types of treatments with the braces to see if that helps people to be able to return to function before having to advance to a more invasive type of treatment like a surgery or something of that nature. We can actually walk upstairs and talk to a physician, and that's a tremendous advantage, and sometimes that's the hardest part when we get a referral from an outside referral source, just trying to get in touch and figure out what exactly that they are looking for to try to help their patient, and we just walk upstairs and we can find out what that is, and it's a tremendous advantage. Staff has to be caring as a part of the process of caring for patients. I would say it's a mixture of education and the willingness to make sure that you care enough about the patient to do your best for the patient and to make sure that the patient is able to achieve what they're able to achieve. It's a problem-prone profession, and so people are coming back, and you need to be patient, you need to adjust, and you need to work with people in terms of what their goals are, what they want to achieve, and so the caring side is a very important part of being successful in this industry.
My name is Ron Oleski. I am a patient here of Keith Myers. The staff here is fantastic. If I have an issue with my socket, with the fit, I call and they get me in here like within a day or the same day, many times the same day. Your limb changes, your residual limb changes, and you need adjustments, so you depend on the people down here at Keystone.
Technology has been a tremendous improvement for controlling primarily knees in prosthetic patients, though now it's also coming into the foot and ankle. And essentially it's a computer within the prosthesis that not only control how much bend occurs in the knee as the person is walking, but also provide stability so that if the knee started to buckle and the person were about to fall, the computer would recognize that and would protect and keep that knee from buckling. Now, with the computer system, we can have people who are very active, want to climb steps, want to do ramps and curbs, where the knee can keep track of what's occurring and can maintain safety for the patient. And it's amazing, mostly to see what the patients are capable of doing with that type of technology.
I wanted to walk again. I wanted to get back to work again. So I was looking for the most sophisticated prosthesis that I could find, which the foot moves a little bit, and it is also a microprocessor. It allows me to get out on the job, to walk around the job. Otherwise, I'd be sitting in a wheelchair.
A grand majority of patients after amputation feel like their life is over and that they're never going to be able to return to doing the things that they want to do. So many people come in and many people are very depressed. And I actually can think of a number of people who have come in and felt that way and then start using their prosthesis and realize that no, they can walk and become very motivated and walk without assistive devices at some point. It's great to see what their reactions are and how much better that they are able to ambulate and function.
It's given me a lot of quality of life. It allows me to get out onto the job, to work with the men, work with my guys. It allows me to go out to restaurants. I don't have to sit in a wheelchair or use a walker. I don't need people to help carry things for me. I've got my life back again.
For more information about our prosthetic and orthotic products and services, or to schedule an appointment, we invite you to call our office at 570-307-4191.
We may not remember the first time we played ball with our dad and how our palms stung, or the first time we looked over the edge into the canyon below and our stomach dropped. Or the first moment we knew we wanted to be running toward the fire instead of away from it. Or incredibly, that a bomb of all things would shatter us and then unite us. Ours is a nation in motion. It's who we are. It's what defines us. Orthopedics is the specialty of second chances. The fitness to throw the winning pitch, the ability to come to your neighbor's aid, the occasion to walk down the aisle, the courage to climb along a knife's edge. In a lifetime full of chances, it's the second chances we cherish. Not always remember your precious firsts, but the American Academy of Orthopedic Surgeons bets you'll remember your second first.